Hi, folks. Thank you very much for your involvement today. We know there have been some wonderful sessions the past day and this morning. We'll just run into it to the people who will really have the most to say. So I'll introduce our first speaker, Kevin Cromar, who's our HAQAST Investigator and Tiger Team Lead from New York University.
Great. Thank you, Chris. We're actually going to give you something a little bit different. Bryan, Duncan, and myself are going to be tag teaming this presentation. So we'll be bouncing back and forth a little bit. Hopefully we can keep it interesting for you. But I'm grateful we have this opportunity to share with everyone today. We're going to be sharing about both a Tiger Team project that's ongoing, as well as a core HAQAST project together, because they have a lot of crossover that we felt like would be appropriate to talk about at the same time. We also want to mention Anna Prados. We have many collaborators that we'll mention as we go throughout, but Anna has been a core collaborator, and we're grateful for her contribution as well. If we can go to the next slide there. So these two projects, the first is led by Bryan Duncan. It's a core HAQAST project about integrating NASA resources into the standard operating procedures of low and middle income countries. And this is a great capacity building project we'll share more about in a moment. We'll also be talking about a Tiger Team project that I'm leading, enabling stakeholder access to NASA data products. And I just wanted to give kind of a big picture. What are we really trying to accomplish with these projects? And really, you could say this for any of the HAQAST projects. If I were to describe it, what I would say is we really want to see real world impact. We want to see real changes that benefit the lives of people who can use these services. And the way we approach it to try to accomplish that goal is we have this question we'll ask ourselves, which is, what is the knowledge? What's the information that's needed in order to make better decisions, better public decisions in particular? And so the research is designed in a way so we can generate and disseminate that knowledge to inform the provision of public services and better public decision making. So that type of use-inspired approach and asking research questions in that way really allows us to make sure the project is focused on that end goal, real world impact. And that's the standard that we're going to hold ourselves to in evaluating the success of these projects. Of course, we'll do papers. Of course, we'll have some great stories to tell. But the standard we're going to hold ourselves to with these projects is that real world impact that can benefit the public. So I'm actually going to pass it over to Bryan now for the next couple of slides, and he can introduce some of the scientific rationale for these specific projects. Go ahead, Bryan.
Okay, good morning. Next slide, please. Okay, so the motivation for our two projects really came out of an American Thoracic Society workshop that Kevin and I led in, I believe it was May of 2017, so it's been a few years back. And in this workshop, there were about 30 health and air quality professionals from a number of different disciplines and expertise in different air quality data sets. And the whole idea was to figure out how these health and air quality professionals around the world could make use of all these different data sets, how to bring them together into in an integrated way. And these different data sets, some of them are very non-traditional, such as from satellite data sets, global air quality models or regional models, low-cost sensors, and your standard regulatory quality stationary monitors. And we also, in this workshop report, the references at the bottom, we really saw the potential of these non-traditional data sets for health and air quality professionals in low and middle income countries, because many of these data sets are free and publicly available. Next slide. Okay, and so, as I said, that was the inspiration for both of our projects, and especially my HAQAST project. I'm the PI, Kevin and Anna and several others are involved in it. And the idea here is to work with a core set of, say, 4, 5, 6 health and air quality agencies or air quality managers to figure out a way to integrate these NASA resources and non-NASA resources into their standard operating procedures. And so the idea is that we would interact with each of these agencies initially in more of a listening session type of format to hear what their needs are, what their day-to-day activities are, and where these NASA resources could be best applied to help them. So NASA has an air quality forecast system. It's a global system, and it went live, I think it was about November of 2018. And that is led out of the Global Modeling and Assimilation Office at NASA. Christoph Keller is the brains of the operation there. And one thing that he noticed is that, or he saw the need for, is that these air quality forecast systems are only as good as what you put into them. So we didn't, he didn't have the information, say, on emissions from many places in the world, reliable emissions. So the forecast wouldn't be as high quality as you would like. Also, there's some other limitations of the forecast system on a global scale, such as spatial resolution. So he developed a machine learning technique that used air quality observations from in situ monitors to bias correct the air quality forecast from this global forecast system. And the results are really excellent. And there's a lot of promise there. And he's been working with the World Resources Institute to figure out a way to scale this process up so that any city with air quality information can access tailored forecasts for their city. So that's an independent project. Of course, there are numerous satellite data sets that come out of NASA and other non-NASA agencies. And then there's a possibility of low-cost sensors. So we realize that because of expense, many of these cities in the LMIC just can't afford regulatory grade monitors. So we understand the potential of low-cost sensors. So we collaborate with Clarity. It's a low-cost sensor company out of California. So go to the next slide. Hey, Kevin.
Yeah, we wanted to walk you through, these are the current cities we're working with through Bryan's core HAQAST project. And I wanted to give you a sense for how do we set these up. Sometimes after the fact, it's easy to see how the collaboration works well together. Sometimes if you haven't had experience doing this, it's hard to envision how do you go from just starting out to setting up one of these meaningful collaborations. So let me kind of give you a sense of how that goes. One, there's initial contacts made with many different people. But once we get an initial meeting set up, typically what will happen is, what we'll do first is we'll share a little bit from a list of options, different things, different resources, different types of analysis that we might be able to work on together. It's like presenting a menu to potential stakeholders. And so we'll go through that in a relatively short presentation. But then the most important step is we take time to really listen to their needs. We'll turn it over to them and they'll describe their challenges, the things they're working on. They all have a boss who's asked them to do certain things. And so we'll listen to them and we'll get a sense for, based on the menu of items that we've shared with them, which of their challenges might sync up. And these are great conversations. And you know, sometimes they have a list of items that don't sync up very well and there's not an opportunity to work together. Other times it's fairly obvious that we have a specific product that we're sharing that will directly meet their needs. But we never know going into it. And being open to those possibilities and being flexible, I think has really been a key in setting up some of these meaningful relationships. One thing that surprised us for this specific project is we anticipated there'd be a little bit more interest in the straight air quality data products to augment their current systems. What we found is a lot of these cities actually wanted a little bit more support in terms of the health research side and how they can handle risk communication. And that was something that wasn't anticipated, but we were happy to be flexible and meet their needs. Let me just share some specifics of these 5 cities. The first one in Rio de Janeiro in Brazil. We're working with them. They have the most capacity of any of the cities we're working with. They actually have a whole team of staff and experienced individuals that are able to do some great work. But what they need from us is a little bit of additional capacity building in terms of some more advanced techniques, particularly as it comes to incorporating air quality into health analysis, and then doing some higher level health analysis that can form specific policy decisions. So all of these projects are capacity building. In this sense, we're not doing a lot of the analysis for them. We're really being guides and helping give some additional training to their staffers. And that way, when we're done and we step away from this project, they're going to be able to continue to move forward and have these new skills to move forward without us. So for real, we're hoping that we can improve their risk communication, and hopefully it'll translate all the way through to policy. Do they change and improve how they handle communicating air pollution risks to the public? Quito, Ecuador's similar, where they want help with their health research and with their risk communication, but they're different in terms of their internal capacity. So while Rio de Janeiro might have 4, 5, 6 staffers who can work on it, in Quito you have a individual who has responsibility over this area. So here we take on ourselves, and we're still doing capacity building, but here we're going to help out a little bit more with the actual work with the data. So we'll have some of our team members help with preparing air pollution data sets and health statistics and prepare it for health analysis. So we'll be a little bit more hands-on working with the data with them. But again, the end goal will be increased capacity on their end, improvements to their risk communication, and changing how they report risk of air pollution to the public. We're working also with a state in Mexico. We're kind of in standby mode. When we presented a menu of items to this group, they wanted everything. Everything sounds good. Why don't we do everything? And so part of our role is to help them focus and say, well, let's choose a task or a data product that we can work on together. And so we're still working with them to kind of hone the scope, and hopefully we can do that over the next couple months. We're very excited working with 2 Eastern African nations, Rwanda and Kampala. The reason we're so excited working with these 2, a couple of aspects. One, there's some local researchers we've collaborated with who are committed to the area. That's going to be a great help in making sure there's sustainable aspects to the project. Second, particularly with Rwanda, we have buy-in from the highest levels of government officials. This is a key aspect of working with stakeholders, both domestic and international, but particularly internationally, you need to make sure you have buy-in from the individuals who have decision-making authority. If you don't have that, you can spend a lot of time on a project, and ultimately you might not have an ability to influence any policies or any operating procedures, because the person you're working with isn't sufficiently senior to have autonomy to make decisions that can impact the project. So in Rwanda, the head of REMA we've engaged with and is supportive of the project. We're now at the stage where we're assembling a technical committee that can execute the project. But we're very optimistic and excited working with both Kampala and Kigali, Rwanda. That's all I'll say about that. We can move on to the next slide here. I want to talk about impact here. Obviously, for these specific cities, it's going to be a great thing for these cities. The problem is it's too slow. There's not enough of us to do this for every city around the world. So it becomes a question, how can we scale up this impact? And the impact is scaled up in 2 ways. One, by focusing on capacity building, we can make sure it's sustainable at that particular city. Also, these cities often work with conglomerations or groups of cities. They're part of consortiums. And whenever they have something new and exciting, they'll go attend these consortium meetings and share it with other cities. And inevitably, there'd be some interest from those other cities to do it as well. So you can have some natural kind of organic spreading of this new ability. But even with that kind of organic spread, we want to make sure we can do it even faster. And that was kind of the basis of developing the Tiger Team project. And I'll pass it over to Bryan now to talk more about the Tiger Team for how we can scale up this impact.
Okay, so here is a list of the HAQAST Tiger Team members, as well as the stakeholders that we're working with on this project. And a number of these, as you can see, there's quite a few HAQAST team members. Next slide. Okay, so as Kevin mentioned just a minute ago, that this Tiger Team project was really based on stakeholder feedback. So I took the lead on this to take stakeholder feedback from a number of different sources and work with people who know about these different sources of information to distill everything down into a set of recommendations on how best to improve stakeholder use of NASA resources? What can we do? And just to give you a little background of some of this stakeholder feedback, so the NASA RSET program is a capacity building program that's been collecting feedback from air quality and health stakeholders for more than a decade. So Anna Prados, who was the team lead of RSET since the beginning, was an invaluable resource on this. And I also had experience, I was part of HAQAST and the first HAQAST and now the HAQAST 2 here. So I've worked with air quality and health professionals for a long time. So I had an idea of what they needed as well. But we also collected data in a health and air quality workshop that was held by NASA last year, where there were 3 or 4 days of discussions with health and air quality professionals about their needs. So, so we distilled all this information down. It's in this paper here. And 3 of the main categories that we grouped our recommendations under were capacity building, of course, through the NASA RSET program, illustrated case studies of a cost-effective approach to air quality monitoring. So we developed a few different examples. For instance, for Kigali, Rwanda, they are seasonally affected by agricultural fires, smoke from agricultural fires. And we brought together a number of different air quality data sets from satellites, the NASA Air Quality Forecast System, and so on, to show them how these type of events can be characterized and the forecast, how they can be used to alert the public. And then finally, we found that most of the air quality and health professionals really wanted process data products for their health and air quality applications. Many of them just they don't have the time, they're interested in capacity building, but they just don't have the time to process data sets themselves. They don't have the financial resources or expertise in many cases. And so it's just not a reality for many stakeholders to devote the time to learn how to process, download, and evaluate data sets. And one of these, one of the most popular data sets is Surface PM 2.5, which is a heavily derived product from satellite data and models. Next slide. And so this last point on these derived products that are specifically for health and air quality professionals is a focus of the Tiger team. Next slide. One thing that came out of the stakeholder feedback were these following categories of what the health and air quality stakeholders really wanted. The first one is validation. This is probably the most important, the most common that we heard, is that the health and air quality professionals, they wanted to understand how the satellite data products of the model forecast, for instance, related to quantities that they are familiar with, like data from in situ monitors. They wanted a clear assessment of the uncertainties and errors. They wanted clear documentation that accompany each of these products, and not necessarily from a scientific perspective, but more from how they can actually use these data products in their day-to-day activities. Ease of access was very important as well. They wanted the data to be easily accessed through web tools, for instance, or APIs. And they wanted us to make recommendations for which data products that they should use for a particular application. For instance, there's a number of different data sets out there, say for PM 2.5 or Surface NO2, and they want to know, which ones should we use? It's a very daunting prospect for them to have the expertise to figure out which of these data products they should be using. And they also wanted a mechanism for their feedback to the people who are actually developing these data sets. And ultimately, they wanted a guidance directory where all of this information was stored in a one-stop shop type of an environment. Next slide. Okay, and so as a first step, in this Tiger team, one of our goals is to actually develop a prototype of a guidance directory. And again, we can't solve this problem. This is bigger than our Tiger team, but we can at least take the first steps towards this. Next slide. And I think this is you, Kevin.
Yeah, this is our last slide. We just wanted to show the HAQAST members participating. We're largely leaving it up to them which of their HAQAST data products they want to contribute to this one-stop shop. And we're grateful for all the HAQAST members being willing to do all the work it's going to take. We're working with Guest Disc. Jennifer Way is the next speaker, and she'll explain more about all the great things that they do. But we're grateful for the HAQAST members participating and the people we're targeting. We had Michael Geiger, who I think is here at the meeting. He's developed some skills so he can use it for the Connecticut DEQ or whatever their agency is called. That's not really the person we're targeting. We're really targeting someone a step down, someone who maybe doesn't have the time to commit to develop that same expertise. And we're hoping this one-stop shop will really broadly increase the number of people who are able to make great use of these fantastic HAQAST data products. So we thank everyone participating in the project, and we're really excited about the possibilities, what we can accomplish together. And that's all we have for you guys today. Thank you so much.
Wow, wonderful. Thank you very much, Kevin and Bryan. I think that really illustrated quite nicely sort of the range of experiences and scenarios one might encounter while working with stakeholders. As with our other sessions, this session is paired nicely with sort of core HAQAST members, as well as our key collaborators, partners, more than stakeholders, to be really honest, people who are really engaged with us in the trenches. So the next two talks will be to those. And then just per sort of our conventions, we appreciate, you're welcome to type your questions in the Q&A and chat, as Alex mentioned, as you go, but we'll address them at the end of all the speakers in about 20 minutes. So just to not omit his affiliation, for Bryan, who you just heard from, in addition to Kevin, Bryan's affiliation is with NASA's Goddard Space Flight Center, and we'll be hearing from Jennifer Way from Goddard Earth Science Program. Jennifer, all yours.
Hello, hi. So can you guys see my slides properly?
I see it in the Internet Explorer window.
Yes, well,
okay.
Kind of. So I'm not putting on the presentation mode, so I guess it's okay. So I'm putting on the slide mode, and thank you. I think thank you, Kevin and Bryan, inviting me to sort of highlighting you some of the recent NASA Earth Science Data Information Division. They're more updating or work that maybe this group is not aware of. I think it's really glad that I can speak to this group. And so my name is Jennifer Way. I am coming from Goddard Data Center, and it's called Goddard Earth Science Data Information Center, and I serve as a DAG scientist. But as you may know, NASA Earth Science Division has 12 data centers. Until recently, I serve as this project scientist. So I'm very happy to talk to you about what is the recent activity, especially headquarters recently talking about open sciences. How will be the data center to respond and support this open science perspective? So there's something called Science Enabling Center. So I think this is a very good way to serve this community. So my title is Science Enabling Center for Air Quality and Health. So this is my outline today. I would sort of tell you what is the Science Enabling Center. How would this new concept to support NASA open science, especially over the years, and the data center is no longer just the archive and data distribution. It has been evolved, but what the open science from headquarters sort of wanted the data center to evolve more, put in more resources to support application such as this HAQAST, health and air quality related. So I see there are a lot of conversation going on, and people are talking about utilizing NASA resources, but maybe you all know or certain resources that from different data centers or a research facility. So I'm gonna sort of update to you what justice, at least right now, we can offer to this group. And what I want to sort of take away, I would like to hear more from the group is what is your science exploration journey, because we have different stakeholders, they have different needs. What we call from the data perspective is your persona, because that drives the resources that we are hoping to put together. And everybody should just come into this one-stop shop, don't need to sort of go around everywhere to hunt for what they're looking for. So basically, what is this science enabling center means, and what is this open science to NASA environment, or actually is open science to all the other agencies, to the research community, is to build a trust in the science process through this transparency, accessibility, inclusive, and reproducibility. And in a way that headquarters is sort of highlighted the guidance to the data center to support this open science. So I want to sort of draw your attention at the number, especially number 3 and 4, because the data center already doing a very good job in curating the data and metadata stewardship and providing some kind of information or documentation when we communicate to our users and guiding the users. And then there's a biggest component is where we are the front facing, interfacing with the user side. So we really treat this user support as our high priority. But in addition to support the open science initiative is the number 3. They want the DAG, the new DAG, the DAG to put more emphasis on this open source science software support. But the number 4 is really, put emphasis on the across NASA mission and division science, as well as put in more resources on supporting application to better integrate and fuse observational data into a decision support data information system. So this part is what recently Justice has been sort of supporting in terms of the air quality data. So as I earlier, I put in the our recent EOS article, and one of your Tiger team members, the co-author, is underscoring, the major challenge for the communities are many source data, especially, like Justice is facing. We're not serving for air quality data. We're serving multiple missions, multiple disciplines. Because we're hosting a designated, a data from SMD, but what sort of signify Justice from other data centers or research community repository, we are the core trusted seal for the NASA data. Okay, so here I'm sort of listing out a parameters that may interest to the air quality related and coming from multiple missions. So there's ozone, there's PM 2.5, PM 10, carbon monoxide and what have you. And until recently, when Kevin and Bryan approached me and they sort of raised this concern or needs, and they would like justice to archive HAQAST data sets. And I think this is a great idea. And in the middle part is we not just archive the data, we provide a suite of the services associated to serve the data and to facilitate data to make ease of the user needs. I saw earlier Bryan and Kevin's the chart that based on the data temporal and spatial resolution needs for the community. And I actually have a very similar chart that's from the user side and the user knowledge of the NASA data. But without partnering with the right people, so I list out the partnership that we currently have, not only with our sister DAGs, but also with like the RSAT people. They're the one, going out and taking the NASA services and train the people based on their knowledge. And now I think, HAQAST could be our partners as well. So idea is to ease of the user experience while keeping the science content in contact. So what I want to sort of talk to you about is, or later on, we can have more discussion is, who are you? Who is this HAQAST community that we're trying to serve, right? And I sort of put it out this very simplified quadrant as a template. So as the data center infrastructure that we want to know is your science journey. Who are you? What are you trying to do? What kind of problem you trying to solve? And what is the current steps that you have to take in order to solve your problem? So, what would be your easy button or wish list? If you can just sort of have one easy button, what would that look like? So I sort of list out 3 sort of user persona or user journeys. So that's what currently we have seen. We have seen a lot of non-earth science students or university people. They're trying to analyze some environmental data to complete their work, right? And so how do they solve? They have to search around the web and they trying to figure out where they are, and then they will contact individual research center and say, well, can you give me some guidance, right? So what they would like to do is this one single website to list out the entire, things that they're interested in. So that's just one of, we see a lot of, that will be the major pain point that I have seen. And another spectrum of the users is they're the data scientists, right? They just want to get the data. They know how to analyze the data. But again, they have to hunt, many sources from the air quality data. They're hoping, would that be, they are hoping to have a very easier way for them to download and extract the specific information or data set that they're looking for. Okay, so they're hoping if they can have a shareable libraries, so they can easily to apply and incorporate into their sort of workflow. That's what they're hoping for. So another one is, I've heard, I think, throughout this meeting, is your stakeholders, your city planners, your decision makers. You just want the key information, and you're hoping to have some kind of dashboard capability, so to communicate with your citizens or citizen fellow. They just want to sort of tame the information down to a simple language so they can understand. So I'm looking for if I'm not capture what this user journey, and I will sort of give the time till the end. I would like to know what is the science journey that we're trying to capture, and then the team can help together sort of prioritize. I see Bryan and Kevin, they have done a good job. So with that, I'd like to stop. Thank you.
Thank you, Jennifer. Thank you for providing that valuable perspective. I've learned a lot. To be honest, I consider myself more of a public health user, so I've learned a lot just about DACs in general. Thank you. Our next speaker is Sarah Johnson from the New York City Department of Health, who's been a great partner for a variety of NASA-funded projects over the years, and a variety of other. And I think it's fair to say it's one of the leaders in climate change and human health among a variety of other sectors as well. So, without further ado.
Great, thank you so much. Can everybody hear me okay? Yes, great. So my name is Sarah Johnson. I'm the Executive Director of the Air Quality Program at the New York City Department of Health and Mental Hygiene. Even though I'm from the Health Department, I'm not going to actually talk about health at all today, health data, because one of the things we find, and there have been loads of conversations yesterday and today, and they're all so fascinating. But one of the things that New York City has is a history of good in-house within the health department data analysis skills and training, and we have access, to a lot of data and a very kind of what do you call it? Like a captured population. We have such a dense population that there's, there's been a lot of work looking at the association between various environmental exposures and health. So I'm kind of coming to you today, and I'm realizing these previous two presentations may have just given me all the answers I need. So, bear with me if this is sort of, it's just like I should just see above, right? See above. Anyway, here in New York City, one of the things we're really proud of is our New York City Community Air Survey, or HAQAST. So next slide, please. So the idea of HAQAST, it was developed in 2007. It began monitoring in 2008, in December of 2008. The idea was to capture pedestrian level samples of the criteria pollutants at a higher spatial resolution than what is provided by the EPA data, the regulatory data. And so because of course, because of limited funding and, a variety of limitations and the need to make sure we represented all of New York City and all the different kinds of emissions scenarios that you see in the city. We end up collecting once per season, 2-week integrated samples of the criteria pollutants. And the goal of this data is to provide an understanding of the factors that are driving differences in air quality between New York City neighborhoods, and to track those over time, tracking with what we know about the various factors like traffic, like building emissions, like truck traffic specifically, looking at the relationship over time. It's incredibly powerful. You can go to the next slide, please. So as I said, the goal was to get, really cover the city as well as possible, all the neighborhoods. With the number of sites that we monitor at once per season has fluctuated throughout the years for a variety of reasons. We started off with 150, now we're down to 93. And we have them, in all your quintessential, what you imagine New York City to be, right? High density tall buildings, lots of traffic, but we also have, in the city, we have suburban neighborhoods, so we have in the Eastern Queens or in Staten Island, you have lawns and roads and car ownership and like that. And so it was important for us to capture all those different neighborhoods. Next slide, please. And then we look at this data and we have to do, it's not like a human survey where you have to weight it based on the kind of population you've captured, where you've asked your questions. We have to adjust for temporal and spatial and temporal differences, and then look at what the various covariates, the environmental and the built environment factors look like around each of our monitoring sites. And then, we can build a land use regression model from this data, from this analysis. And that allows us to then make predictions of air pollution levels by season in parts of the city that we don't have direct monitoring data from. Next slide, please. And so what we can do is we produce these kind of surfaces, and these we work on a 100-meter resolution grid in order to generate predictions. And what this does, it gives us neighborhood relative differences between neighborhoods that we can, as you can see, this only goes up to 2016, but it's because it's an old image. We can track those changes over time. And that is something really very useful, because air quality has improved in the city, as it has in a lot of places in the East Coast. But it's not the speed at which, the slope at which these neighborhoods are improving, or the PM 2.5 is falling, is varies. And there are some communities that are improving at a slower rate than others. And of course, that's an interesting, folks want to know why. So next slide. And in part of our communication of this, we do an annual report and we look at by community district. And the only reason we can do this is because of the resolution of the data that we're working with. You can go to the next slide. And so as you folks were talking just prior to this, to my talk, was about the importance of getting, open data, getting data out to the public. We do that. It's sort of a part of our requirement. We do like an online report each year, but then we also make neighborhood average values available on our environment and health data portal. We post raster files of the model predictions that we've created on a 300 by 300 meter grid that's on open data, but then also higher resolution and the raw data are available by request. Next slide. What I wanted to say about this was, just to get back to the resolution, again, one of the reason this data is interesting and of interest and is because that we can produce estimates at a neighborhood level, and we could go down to census tract if need be, with a certain level of confidence. The thing that, can you go to the next slide? I'm momentarily forgetting what the next slide is. Oh, sorry, you can go back to there, great. The thing, this has been going on, right? Where we just started our 14th year of data collection. This is a collaboration with Queens College, who actually developed these an integrated sampling box that is battery powered. They have a team that goes out in the middle of the night every 2 weeks, come rain or snow or New Year's Eve or whatever, to mount these monitors. And they continued to collect all through COVID. Like, it was pretty astounding, because even our regulatory monitors, they stopped. They went offline for a small part of the section of time, but it's expensive. I mean, this is we're looking at a project that runs about $800,000 a year to keep going. And the question is does it need to? Does it need to be this? Does it need to be this manually human involved and need this much time. There's a word I'm looking for, I'm not remembering right now. Anyway, but it is also so important. So if you just go on to the next slide, please. We've just finally gotten it published, our where we were able to look at the impact of the shutdown or pause on the PM and NO2 and the other pollutants that we measure through HAQAST during. And one of the things so important that we saw was that while there was a dramatic difference in Manhattan, in the central business district, you saw very little change out in the outer boroughs, where there was still just as much traffic, if not more, as people were relying on cars rather than public transit. And so there was definitely disparities in the air quality improvement during the shutdown. And so on to the last slide. And so I already sort of posed this question, but I'm realizing I can take these and kind of put them into that rubric that that Jennifer just was showing on the previous presentation. So we can do that. But there seems to be, and I've talked to so many different people and been, on NASA projects and around satellite data, and we're getting there. It feels like with Tempo and Maya that we're almost at the point where we can use satellite data as a way to streamline our monitoring process, maybe, and reduce the cost of monitoring by, reducing the actual number of sites where we need to monitor. But, I need somebody to really dig in on our specific use case here and sort of help. We've been working with Yang at Emory, and that looks really, that there looks to be some potential there. We're interested in not just PM but NO2 too, and so this is definitely something that if anybody has thoughts for me, I'd love to hear them. And thanks so much.
Wonderful. Thanks, Sarah. Thanks for some great context, and what a great challenge question. I mean, to be honest, I guess I'll wait to see if people have things that they sort of organically, for lack of a better word, put in the chat box regarding to your challenge question, since I'm not able to quite.
There's also some questions in the Q&A too that we could start with.
Yes, great idea, Alex. So we'll start there. Just as openness and encouragement to everyone to be inclusive for the group. There are no dumb questions, really. I mean, I think the more that we can help connect to you wherever you're at, the more productive it'll be for you. So the first question, I'm just going to go in order of its appearance, was decision-making authority usually resides with political leadership. So do you coordinate? So I believe this was directed to our first two speakers, Kevin and Bryan. But do you coordinate with Department of State or allied national foreign service agencies to help with your outreach efforts?
Well, the short answer is no, we haven't yet. We're only working with a few cities, so we haven't had to resort to that. But if we had to have a more coordinated effort, yeah, we could use the State Department, or we could use other organizations. For instance, we have had conversations with UNICEF, WRI, and other agencies as well. They have a broader reach, so we could go with NGOs, for instance, as well.
Yeah, I'd like to share just a little bit of insight that might be interesting. A lot of organizations, their staff will be on a cycle, like USAID or any other of these organizations. People will be assigned to a particular mission or location for a 3-year cycle. And then after that, they move on somewhere else. It can be quite tricky to work with them. If you don't catch them right at the start of that 3-year cycle, one, they're not going to want to take on a big project a year before they're going to move on. So you almost have to time it just perfectly. You catch them right at the start of the 3-year cycle, and you have to wrap it up before they move on. The other thing, a lot of times working with cities, the decision maker who you ultimately want to team up with, often they're a political appointee. So sometimes you have a similar timing where the start of an administration, you want to start working with that city. They might be in there for 4 years, and then you got to kind of have it wrapped up before the next administration comes in. That's true domestically, that's true internationally. And so some of our most effective projects, we time it up with that cycle, and you can have a really fruitful collaboration. And then depending on what happens with elections or things that are totally out of your control, you then have to have it finished. So that's just kind of the reality. You have to take into account those factors when deciding who to collaborate with.
Wonderful.
I can
Please
just
feel
say
free.
one more,
Oh, sorry,
one
go
more
ahead.
quick thing about that. I think the most important thing that we discovered is that each of these agencies, we really need a champion, a stakeholder who is really invested or devoted or enthusiastic to help us, to work with us, to move it forward. So, and we have that in our city so far, and we're very fortunate. But again, you just need that champion stakeholder, the one that's willing to work with you and see it to the end.
So I'd like to chime in on this part. I think
Please.
that's the primary focus for open science is about, because we want to share with our knowledge and we want to get the feedback from the community. And as far as I know, this open science concept has been ongoing, and a lot of countries or agencies, you know, they're also sort of get buying on this kind of concept. So without sharing and caring about our community, we never really know. So it really takes the whole community's effort.
Thanks. And this one can be answered by anyone on the panel as well. There is just a question about, thank you for the information. Is there a satellite data product available that can be used to evaluate air quality in parts of Central and Eastern Europe for some criteria pollutants, but as well as other things like carbon monoxide, carbon dioxide, and methane? And there was a reference to RSET, but I wanted to provide the panel the chance to also provide information, other information if they wanted to.
I can just quickly say that the answer is yes to some of those. For instance, there's a PM 2.5 product, certainly. There's a surface NO2 product as well. SO2, that's a little trickier because it's a bit of it's harder to observe from space. It's a noisier product. CO, there are products, but again, it's I'm not sure of any for surface CO. There may be. Jennifer could probably answer to that. And I'm less familiar with CO2 and methane, but there is information for each of those out there that could be useful. It would take you a little bit of time to look at it and figure out exactly if it's useful for your particular application. And in the chat, I put a link to the NASA RSET website. They have a wonderful introduction to satellite data, and they have some online trainings that are available. They're archived. You can take a look at them on the fundamentals of remote sensing, as well as some of the basic data products or pollutants that can be observed in space. So I highly recommend you go to the NASA RSET website for to help you understand what's available.
So I certainly want to sort of comment a little bit more, is that, you know, the science team, all the satellite information, they have multiple algorithms. They actually output different type of information content. When people are talking about, you know, do you have methane? Do you have carbon dioxide? Do you have NO2? You know, what usually the community care about is the boundary layer. And sometimes it's really difficult for a remote sensor to have the accuracy down to this level. So I want to sort of like put it out. We do have similar data set, but a lot of oftentimes we are very reluctant to provide the information or the services to users, because we may sort of falsely provide the wrong information, and people just thought, okay, all this information coming from NASA, it must be legit, it must be accurate. But in reality, that's not the case.
Thanks. I'm just going to pivot a bit to Sarah's wonderful challenge to the community, which I can't say I have an answer for, but there were a couple of sort of like follow-up questions related to that. One being in the chat, just I guess asking to understand a little bit more, thinking about the data requirement for 300 meters square resolution. But I'm presuming that means sort of perhaps like mechanisms or outcomes or disparities or something along those lines. But I apologize if I mischaracterized that.
The question being, why do we need it at that resolution? Is that the question?
Yeah, that's my interpretation. Yes, understanding the thinking behind why you need it at that resolution.
Oh, yeah, sure. So one of the things, and I didn't mention this during my talk, which I was going to, and then it totally flew out my head. But you know, we are at the point in New York City where we feel like we understand what air quality looks like in the city, and the factors that are driving the differences, you know, on a neighborhood by neighborhood basis. That doesn't mean we completely have characterized every single, like the impact of every single, say, bus depot on down this, you know, on the corner, but you know, on a citywide basis. And so we are really in the business now of pushing policies that are going to make a difference, right? That's what we want to do. We want to be at the table when DOT is making plans, when DCP city planning is making plans, when, you know, to you know, really push people to think about, you know, what kind of policies and programs and interventions, regulations would be necessary for, you know, reducing emissions from traffic, or reducing, you know, the volume of truck traffic that goes through residential neighborhoods and things like that. And in order to be able to speak potently about that, we need to have data that goes down to a neighborhood level, and you know, providing the context, the sort of immediate context to a street segment, not a street segment, that's too fine a resolution. I mean, but like you know, a set of blocks in a neighborhood, or, you know, a census tract, which in New York City, they're quite, you know, they're quite small spatially, lots of people, but not so much space. And so it's, you know, as far as looking at policy changes, policy impacts, it seems like we're more and more getting in the business of that, because there's a basic understanding of air quality and health impacts in the city. And so that in New York City, like, people really, really want to know what's going on in their neighborhood, right? It's a city of small cities, or small towns. And so it really addresses the people, New York City residents, you know, desires to know what their neighborhood is like. You know, 1 kilometer, working with a 1 kilometer grid is okay. It doesn't necessarily, it's probably, you know, a higher resolution than that would be really our end goal. Did I answer that, do you think?
I think so.
Good.
I mean, and then Kevin had another follow-up too.
Yeah, one I'd like to comment, you know, if you haven't lived in Manhattan or New York, you might never leave your entire life a 300-meter area. Totally. So the life existence is a little bit different. You know, it's hard to overstate the value of NICAS in its ability to communicate information to the public, because it gives this beautiful snapshot, this map of what's going on. You know, I worked with the team, you know, the Mayor's Office of Long-Term Planning and Sustainability. We helped enable a compromise around heating oil regulations about 15 years ago. And we did all this work. We estimated all the health impacts. We were able to get the policies passed. But for the public, being able to show them a single map showing this is why we're doing it. And one thing it highlighted was a lot of the buildings burning this oil that was going to be regulated was in the wealthiest part of the city on the Upper East Side. And that really helped the public realize, oh, this is a good policy. So the power of information.
But it's totally true. But yeah, no, you're right.
So I had to follow. So the power of it for public communication is evident. There's examples of it. I did have a question for Sarah on the planning perspective policies. I think I know the answer, but I asked that question anyway. Has there ever been a circumstance where, because of information you learned from NICAS, that you changed policies you were considering? Or is it mostly about communicating the rationale to the public for the policies you would have done anyway, even if you didn't have NICAS?
Well, interestingly enough, actually, and one of the things that makes my job really interesting is the fact that almost nothing, the health department has no jurisdiction over anything that is related to air quality. Indoor air quality, yes. So lead paint, asbestos, yes, but outdoor air quality. So we are really more operating on an advisory role, right? As trying to provide data to, right? I mean, at these last maybe year or so, there's just been, a number of projects I've gotten pulled into that are, aimed at greenhouse gas emissions reductions. But the question is will they also result in air quality improvements and therefore health benefits? And so there have been definitely cases where, the mayor's office of sustainability is debating between which strategy to push, and, our feedback on which ones would provide also local health air quality benefits, has helped them to prioritize what they're pursuing. We pushed hard to get additional commercial cooking regulations into the air code. This was in 2015. And that was from, it wasn't directly because of data generated by NICAS, but there were some sort of side projects that were done by NICAS staff in response to questions that people asked about the smoke that you could see coming out of restaurants that are grilling burgers or steaks, and so we're still working on getting that implemented, but commercial cooking is definitely sort of our next residual oil, in the sense that it's something to tackle because it is, a pretty big component of PM in the city, but it's a challenging one.
Daniel, I don't want to dominate a New York City discussion, but could I share one small anecdote that might be of interest to people? Yeah, let me go ahead. So this is about 15 years ago. New York City now is going to do congestion pricing. They're rolling that out. They've tried to do it 15 years ago. And the mayor's office had this big plan. They were going to do it. About 2 weeks before rollout, they went to Sarah's department and said, we need you to tell us what the health impacts of this will be. And the health department had to tell them that, well, there's no way you could do that type of analysis in 2 weeks. And if they would have done the analysis, it turns out it actually isn't very impactful from a health perspective. It just isn't. It's great for raising revenue that can be used for good things, but it's not going to make a big impact on health. But the reason I tell this anecdote is policymakers, even ones, it was the Bloomberg administration, they want to use data. They wanted to be evidence-based in what they're doing. They just don't have a good concept for the timeline it takes to do scientific research to inform those decisions. And so that's part of the process as well. If you want to interact with policymakers and stakeholders that make decisions, they don't know it's going to take you 2 years or so. So that's part of the learning process everyone has to do together. And the hard feelings between Department of Health and Mayor's Office, I think, finally were worked over. But it was a fascinating thing to see that tension and misunderstanding.
Oh boy. Yeah, no, that's absolutely true. And actually, one way we try to respond to those kinds of needs is by building tools that could allow for more rapid assessments. But then you're often trying to second guess what are the policymakers going to be, thinking about today, before you, in order to be prepared.
Wonderful discussion. We have one that's about data standards in general, which I'll just propose. It was suggested, is there value, or perhaps there is value, in promoting the emerging spatiotemporal asset catalog, or STAC, as a standard that can standardize metadata, search, access, etc., and can help scale and address data access in a broader way than matchmaking to particular topics? I guess then I'll state the other one just in the interest of time, and panelists can choose to respond to either one question. Will making a curated list of the health and air quality data sets require further maintenance as models get outdated and still have interested users? So I guess that one essentially is, how can we sort of build in updating of these curated lists over time, even if some of the investigators are moving on, or projects are moving on. But so panelists may choose to answer either, or put their own comments on top of those.
I guess I can answer that question. So this is a typical case that people throwing a stack is a jargon, and I'm sure some of the people may not know what that means. So this is part of the open science from the data infrastructure we're trying to sort of accommodate. So this jargon actually is more towards consolidating or compiling all the catalog in this specific stack is applying in the cloud world. So cloud right now, a lot of agency is trying to put the data in the cloud, and the cloud is we're trying to feedback and allowing community to use. So the stack is one of the catalog sort of providing the indices. So the short answer is yes. NASA and in collaborating with other agencies, we're trying to do that, and in a sense is to have the easy access for the community.
Other thoughts on that one, or the I guess updating or further curation of health and air quality lists on the stack over time?
Yeah, I just wanted to pipe up is that the folks like myself who may be interested in using the data in like some really consequential ways, we may not have the time to actually compare and contrast. I mean, we know our requirements, but there are so many different data sets, I think, as Jennifer pointed out, that are available. And so to some extent, having sort of a mentor or someone that could say, okay, I think you want what will work for you would be X, Y, and Z. So lists are great, but they also can be overwhelming for folks who are not, speaking this all the time.
Just checking. And then, so Jennifer, just bring it. I love your easy button. I mean, I think there's quite a few things I'd like to click it on, including writing papers or cleaning up the kitchen. But in terms of your, I'm thinking sort of going the other way. I'm just curious if there's has been requests to also sort of centralize health information for like an NASA audience. And there are some barriers, unfortunately, more so on the health side. Sometimes it's a human subjects agreement, but oftentimes it's actually just a data use agreement, meaning that that agency doesn't allow anyone else to store it or serve it. But just curious, even if there are things such as concentration response functions for health things that are standardized and could be stored in a common place, but just throwing that out there.
Well, if this team, actually HAQAST team, is producing that kind of parameters, I guess I would be happy, or to sort of host that data and serve to the community.
Thanks. I would just like to thank all of the speakers who talked today, and as well as everyone who participated, listened, put their comments in, as well as if you're mulling it over, please feel free to reach out to us if you have other questions. I'll turn it back to Alex, who might have further guidance.